Imagine yourself in the emergency department. You get a 45-year-old male person coming to you with sudden onset severe headache. The patient describes this as the worst headache of his life. What are you thinking? Well, though it's not common, what you should be considering is subarachnoid hemorrhage. Now, not more than 3% of such patients will actually turn out to have an hemorrhage, but if they do have, and if you miss it, the consequence is going to be disastrous. So how do you consider subarachnoid hemorrhage? Well, the biggest clue is that the patient has what is called a thunderclap headache. What does that mean? Well, as we just now described, it's going to be one of the most severe headache that the patient has experienced. But not just that, this is a headache which is going to peak rapidly. It's not going to take its own sweet time to rise, but within 1 hour, less than an hour, the patient would have such severe headache that he'll say, I've never experienced this. Add to that the possibility that the patient is more than 40 years old, or if the patient has lost consciousness, or there was a seizure that was seen. If all of these features or some of these features come together, keep a very low threshold to consider subarachnoid hemorrhage. And if you consider that, what do? Two things. If within first 6 hours, the best thing to do is a CT brain. We can also consider a CT angiogram if you are trying to search for the bleeder. But after 6 hours, one more test that can help you is doing a lumbar puncture. I hope you remember this the next time you see a patient with headache.